Hey guys, it's Miss Reyes and Miss Ratcliffe from the Skills Lab. We're going to be going over PPE donning and doffing today. So the first few things is we got to make sure that we have our card, which Miss Ratcliffe does. So some of the equipment that you're going to be needing will be a gown, a mask, and we have a couple of different masks. We have the masks that have the elastic ties,
and then surgical mask.
And then there's a respirator that you might need to have. And then there's also some other masks. They are the tie masks where you would tie top and bottom or bottom and top. And then we have gowns, of course, and gloves. Okay, so the sequence for donning personal protective equipment is you're going to put the gown on first, and then you'll put on your mask or your respirator. And if you have goggles or a face shield, you'll place those on at this time, and then gloves. Okay, so Miss Ratcliffe is going to apply the cover gown. She's going to fully cover her torso from the neck to the knees, her arms all the way to the ends of her wrists, and she's going to wrap around the back and fasten behind her neck and her waist.
One important thing is that you're not dragging your gown, even the ties, on the ground, because it's not clean and you don't want to wear the hospital floor on your body. So make sure when you're putting the back on that you are completely covering the back of yourself. Sorry, it's taking me a minute, y'all. Okay. Am I completely covered?
Yes. Okay, so now she's going to apply her surgical mask or her respirator. It's going to be the surgical mask. She's going to secure the elastic bands behind her ears. And then once she does that, she's going to fit the flexible band to the nose bridge. That's that little piece of metal that's right above her nose. And then she's going to make sure that it fits snug to her face and below her chin. If she was putting on a respirator, she would have already had a respirator evaluation, medical evaluation, and fit test to ensure that the respirator fit her face specifically. What you'll need to do with the respirator is if you have to apply one, you have to make sure that you grab the right size. Okay, at this point, this is when she would apply any face shield or goggles. Now we're going to move to the gloves.
And we're not putting goggles on or a face shield because we don't have enough for everyone to use. So for this skill, you will not be required to put this on, but you may be required to put it on in a facility.
Okay, so she's going to apply the gloves, and she's going to make sure that it extends to cover the wrist of the isolation gown. So she's just going to tuck them right in.
So you want to make sure you take your gown and you're actually pulling your gown down inside of your gloves. So you're completely protected on your wrists. Your wrists, not risks. All right, and I'm ready to go.
Okay. Okay, so now we're going to remove the personal protective equipment. There's two methods. One is called the Pop Method, and the other one is called the Untie Method. Both of these ways are correct methods to use per the CDC. So we're going to start with the Pop Method. So the sequence for this is going to be taking off the gown, then the gloves. If you have a goggles or face shield on, that would be removed next, and then the mask or the respirator. So to remove the gown and gloves, you're going to grasp the gown in the front with gloved hands. You're going to break those ties, touching only the outside of the gown. While removing the gown, fold or roll the gown inside out into a bundle. As you are removing the gown, you're going to peel off your gloves at the same time, only touching the inside of the gloves and gown with your bare hands. Once you get the gown off, you're going to place the gown and the gloves into a waste container. Okay, so at this point, if your hands got contaminated in any kind of way, you would wash your hands or clean your hands. At this point, she could remove her goggles and face shield, but she doesn't have any, so we'll move to the mask and for her to remove that. So the front of the mask is contaminated. Make sure you do not touch it. In between taking off the goggles and taking off the mask, if your hands get contaminated again, be sure and wash them. You're going to grasp the elastic of the mask, and then you're going to remove without touching the front. You're going to discard straight into a waste container. And if you have the mask with the ties, you're going to make sure that you untie the bottom ties first and then untie the top ties, because you don't want the top to flop down and touch you.
And unfortunately, we don't have one of those masks today to demonstrate. But yeah, the top, if you untie the top of your mask first, it's going to flop down onto your clothing. And then you're going to wear whatever your patient had in that room, in that isolation room. So don't do that.
Okay, and then you're going to perform hand hygiene. Okay, so now we're going to remove the personal protective equipment via the untie method. And for this, the sequence is going to be her gloves first, the goggles or shield if you have one on, then the gown, and then the mask. So to remove the gloves, the outside of the gloves are contaminated. So she's going to use her gloved hand. She's going to grasp the palm area of the other hand and peel off the first glove. She's going to hold the removed glove in the gloved hand and slide the finger of the ungloved hand under the remaining glove at the wrist and peel off the second glove inside out. She's going to discard in a waste container. At this point, she would wash her hands if they're contaminated, and she would remove the goggles or face shield. If her hands got contaminated again, she would do the same thing before removing her gown. So to remove the gown, she's going to unfasten the gown ties. Take care that the sleeves don't contact your body when reaching for the ties. Okay, so she's going to pull the gown away from her neck and shoulders, touching inside of the gown only. And as she's doing so, she's going to roll it down. She's going to make sure she's turning the gown inside out. She's going to fold or roll into a bundle and discard into a waste container. She's making sure that she's only touching the inside of that gown. Okay, so if her hands got contaminated, she would wash her hands again. Remember, the front of the mask is considered contaminated, so we're not going to touch that. She's going to grasp the elastic ties around her ears, and she's going to remove without touching the front and discard it in a waste container.
All right, guys, let us know if y'all have any questions.